Hi, Dr. William Portuese here in Seattle. Today I'm talking about dorsal hump removal with closed rhinoplasty. Patients with a large dorsal hump tend to be very self-conscious about that hump from the side profile. And if their nose is crooked, they always are turning their head towards the camera at a tangential angle so that their nose looks good without shadow effects. Once we've removed that hump, their self-confidence really tends to shine. It really tends to improve because they're not having to worry about what angle people are looking at them from, like a side angle or a three-quarter angle, and having to adjust their head position all the time to have a conversation or take a photograph. You take the hump off and the hair is back and there's big smiles and the confidence goes up and they just tend to blossom. The dorsal hump is composed of both bone and cartilage, and it has to be shaved down in order to remove it. So what we do is we make some incisions on the inside of the nose, go in and shave the hump down. Once we shave the hump down, we have intermittently created an open roof flat top nose deformity, and so we have to then go in and perform osteotomies in the nasal bones. Osteotomies are little cuts in the nasal bones that allow us to close the open roof created from the hump removal. And that allows the nasal bones to be in a more narrow position that looks refined, feminized, and balanced with the facial features. So the surgery itself is a closed rhinoplasty. All of the incisions are placed on the inside of the nose. The stitches are dissolvable. The cast is applied on the bridge of the nose after I've reset the nasal bones more in a narrow position, take and shave the hump off. The cast stays on for about a week. Then anticipate about 2 weeks of visible bruising and swelling. I take the cast off a week later, and then there's still, there's bruising and swelling underneath the eyes, and that's going to take a good 2 weeks to subside. And then most of the swelling, about 70% of the swelling, is gone in about a month after the surgery. About 90% is gone at about 3 months after the surgery, and then full healing takes about a year. This patient has a over-projecting nose with a very large dorsal hump. Most of the hump that she has is cartilage, and about 3/4 of it is cartilage and about 1/4 of it is bone. And that was all shaved down, and I decreased the overall projection of the nose by shaving down the dorsal hump. I did some minor little adjustments to the nasal tip to make sure that it balanced with the bridge line. And then the osteotomies placed in the nasal bones were mandatory in order to close the open roof flat top nasal deformity that you would see from the frontal profile. So her nasal bones ended up getting narrowed as well. So the whole nose gets smaller. Visibly, the largest amount of change you see on this rhinoplasty is reduction of that dorsal hump and removal of that dorsal hump.